It is Gum Disease Awareness Month, so I'm here in Studio 61 with Dr. Abbas Mohammadi, the owner of Columbia Dental. Thanks so much for being with us, doctor.
Good morning, Erica.
First off, let's talk about what gum disease is.
Gum disease is a chronic adult infectious disease. 42% of the adults in America, age 30 and above, they have some sort of gum disease or periodontal disease. Periodontal disease is manifest by losing the bone. So as you know, bone supporting the tooth in the place. So losing the bone, it results the losing the bone causes the losing the tooth. And the most common cause of tooth loss is the periodontal disease. Unfortunately or fortunately, the periodontal disease is a disease that doesn't have no symptoms, so you cannot detect it until it became very late stage and the tooth start to become loose.
So till it becomes obvious that
Yes,
there's an issue.
and at that point would be too late.
Okay.
So going to the dentist and having a routine checkup and taking radiograph on every 6 months is very critical to detect the disease at earliest stage.
Talk a little bit more about prevention. Most people are able to brush their teeth twice a day. Some people try to floss a couple times a week. What else should they be doing?
Well, periodontal disease is a very complex disease, something that many, obviously besides going to the dentist twice a year, brushing, flossing, something that not been talked too much, there are a lot of other contributing factors is affecting the progress of the periodontal disease, lifestyle. So a lot of systemic disease like diabetes can have a deleterious effect on the gum, nutrition, obesity. All those facts can play a role on a periodontal disease. There are certain nutrition and food that are good for the having a healthy gum.
What would some of those things be?
For example, we can say like a green tea. Green tea has a certain agent, we call it paraphenol. Paraphenol has kills certain bacteria, we call it Paraphemonas gingivalis, that cause periodontal disease. Coconut oil. There are a lot of stuff there. Here at Columbia Dental, in our social media, we try to put all the nutrition tips to our patient or whoever interested to know what can eat or drink that can make the gum,
just help with overall gum health.
Yes, exactly.
Now, I know gum disease is an adult issue. It's an adult disease. But what do we as parents want to ensure that our children are doing to prevent this for them down the road?
All the above. Go for having a checkup, exam cleaning, make sure they brush, floss, and start to having a healthy lifestyle, and it's not just eating healthy stuff, is let's say certain high processed food. It shows a study that start the inflammatory process and start the gum disease. Let's say avoid eating, for example, Cheeto or those potato chips. It can be very deleterious for the overall healthy gum.
So when choosing snacks, always better to choose the more natural snack rather than processed.
Exactly.
Kind of a general rule, right?
Yes, exactly. Yes. Like anything else, gum is a part of our body. And anything, is good for your heart, is good for your gum.
And people don't realize how much it can affect the rest of your body.
Correct, yes. Correct. Because bacteria in the gum can travel to other parts of the body. A study shows that the bacteria from the gum disease can travel to the heart and can cause cardiovascular disease as well.
Absolutely. Well, doctor, thank you so much for being with us. Very helpful information. And you said there's 12 Delta Dental locations all across the state.
Columbia Dental location, correct, yes.
Thank you very much.
Thank you so much.